Stay tuned for Bridge to Health right here on MadhouseTV.com.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hi again, and welcome back to the Bridge to Health. My name is Dr. Tom Dow. Great to see you all again. Each week, we have a special guest on my show from a different healthcare discipline who is part of our healthcare team to help you, the patient. Unlike years ago, in our 4 offices, Melville, Medford, Hicksville, and Ronkonkoma, we have a team assembled of healthcare professionals who, on a daily basis or weekly basis or whenever necessary, consult with each other about the health of our patient base. I bet many of you patients out there are seeing multiple doctors for a multitude of different reasons, and I venture to guess that probably most of them don't talk to each other on a regular basis. That's the advantage of having a center such as ours, because we can treat you, the patient, a la carte and give you the best that every discipline has to offer. Today, I have the special honor of having a guest and a good friend, Dr. David Benish. Hi, Dave.
Hi, how are you?
Thanks for joining us today.
You're welcome. Thanks for having me.
So, Dave, you're a general surgeon, correct?
Correct.
And where did you train? What was your training? What was it like? Where'd you go?
Well, I went to medical school at the SUNY downstate, and then I went to Brown University residency program in Stony Brook.
Okay, nice. And your practice is where? Where's it located?
My office is in Huntington, 124 Main Street.
Right. And how can people get in touch with you? You have a website, a phone number they can call if they have questions?
The office number is 631-423-7000, or directly through my email, which is herniadoc1, HERNIADOC1, @gmail.com.
Thanks, Dave. So let's talk a little bit about the kinds of things you work on as a general surgeon. What types of conditions do you see come into your office, and what kind of work do you do?
Well, general surgery has evolved over the years. Many, many years ago, general surgeons did everything from GYN to orthopedics even. But through the years, there's been increasing specialization, and the scope is narrower than it used to be. I personally am finding most of what I do is now on an ambulatory surgery basis, as many, many procedures now can be done in that fashion, where people go home the same day and recover at home.
Right. And ambulatory surgery, if those in the audience who don't know, is not a hospital. It's a small, kind of like hospital, in which patients, we can schedule patients on a, and they're served much better in these places because they're not bumped for emergencies or things like that, right?
Sure. There are different levels of ambulatory surgery. I do most of what I do at what's called a freestanding ambulatory surgery center, where people come in, parking is easy, very short preoperative time, no delays in operative scheduling, and pretty much go home an hour later with 100% patient satisfaction rates and almost a 0 infection rate. So there are major advantages to performing surgery in ambulatory surgery facilities.
Right, and those in the audience, the surgery center, which you and I both work out of together, is the Melville Surgery Center, right in Melville. And I think what most people don't realize about a surgical center is, as you just mentioned, they probably have much less chance of infection in a surgical center than in a hospital setting. Because in hospitals, people with infections and things like that, and they're walking into there where it's not so much the case in an ambulatory surgical center, right?
Well, absolutely correct. Things have evolved, surgery has evolved to the point where procedures are done where they can be done most efficiently and effectively now. And certain procedures obviously need to be performed in a hospital environment, but more and more procedures are being shifted to ambulatory surgery centers.
Let's talk a little bit about the conditions you work on and how they've changed from years ago when you first started with the technology advances and how they are today. Let's start with hernia.
Well, that is a perfect example where I personally perform almost all hernia surgeries laparoscopically, which means we use 3 small incisions and place a piece of mesh over the hernia site. But the real advantage is that I have people back to absolute full activity in 1 week with lifting 300 pounds. Any activity you can think of is okay, because that procedure is more like patching a tire from the inside, where we're not relying on any healing. And it's a major advance in the treatment of hernias, applicable to just about any patient.
Right. Why don't you explain to the audience exactly what a hernia is? Because most people might, not most, but some people might not know what that is, and the different types and where they are.
Sure. The most common type of hernia is called an inguinal hernia, which occurs in the groin. It's the type of hernia most people are familiar with. And there are 2 forms. There's a congenital form, which occurs mostly in men, where the testis has to move down into the scrotum prior to birth, and if that doesn't occur, there's a pathway for that process which can persist after birth and result in the development of a hernia at any point in life. And the other type of inguinal hernia is more of a weakening or a tearing of the tissues. A hernia is a hole that lets something protrude through. And the something that can protrude through could be a fat or a piece of intestine. So most hernias will need to be repaired at some point if they're causing symptoms.
So they can be in the groin area. They can be in the midline of the abdomen, by the belly button, the umbilicus. And would it be fair to say that if a patient, when they strain and all of a sudden now they look down at their abdomen or their pelvis and they see a bump protruding, that's possibly a hernia?
Definitely. Hernias can occur in the abdominal wall, as you mentioned. There is one type of situation where people might think they have a hernia, where it's just a thinning out of the tissues in the upper abdomen, which can appear as a bulge. But the majority of people who find a bulge or a lump in the abdominal wall will have a hernia of some type. The type of hernia you're describing is called a ventral hernia, and that's a different process to repair.
Got it. Now, I know from being in practice 32 years and seeing patients come in for exams that there are many, many people in the audience right now that probably have hernias, and they have these bumps either in their abdomen or in their groin, which they're not painful, they don't bother them. Could you just explain like when it does become a very dangerous situation and what the symptoms might be and what can happen?
Well, what we call that is an incarcerated or strangulated hernia, when usually a piece of intestine gets trapped in the hole, it starts to swell, and once it starts to swell, if it's a piece of intestine, its blood supply will be cut off, and then the piece of intestine can turn to gangrene, which can obviously be a very serious, life-threatening condition.
Right.
So we never want to let that happen. On the other hand, the average hernia will not result in that condition in the near term. So it's not usually an emergency to seek medical treatment for a hernia.
But would you say if somebody notices a big bump coming out of their abdomen or in their groin, that it should at least be checked out?
Absolutely.
And not wait if it becomes an emergency, have somebody like you check it out, make sure it's safe and nothing to do right now?
Absolutely. You know, assuming that the hernia is what we call reducible, which means you can push the contents back inside.
Right.
I always tell patients, you repair it at your convenience.
Right.
We don't consider that an emergency.
Right. So let's also now talk about MRI and sonograms, because we've had cases together where a patient has come into my office, I do a general physical exam on them, I suspect they may have a hernia, I suspect they may have a gallbladder problem, and we then pick up something on an MRI such as a hernia, just by a routine lumbar spine MRI we might do. And there are sometimes when the MRI doesn't tell you everything, and you go in there and you see something more or less or different, right?
That's correct. Normally, to diagnose a hernia, the most important two components are what we call the history, which is what the patient tells you, and the physical examination, where we feel the area for lumps or bumps or hernias. There are occasions where, for one reason or another, we need to use an imaging technique, such as a sonogram or an MRI, to help in the diagnosis.
Right.
Now, patients come to me often where a hernia was discovered on either a sonogram or an MRI, but my philosophy is if they're not having pain due to that particular small hernia, we don't advise surgery until such time as symptoms develop.
Gotcha. So, those of you in the audience, I want to make something very clear, and something that's changed over the last 20, 25 years, is that when you come to a multidiscipline center and you see, let's say your doctor of chiropractic as your first doctor you see, that this doctor of chiropractic today is fully trained to examine, diagnose, and order testing that's necessary so that if a referral needs to be made, such as somebody like Dr. Banish, it can be made. Dave, we've had, within the last 12 months, I've had 3 patients I've referred to you based on my physical exam. And thank God I got them to you, because 2 of them needed gallbladder surgery and another one needed some hernia repair. And I kind of like suspected this. And what I loved best about one of those patients is that you were over at the surgery center, and I had the MRIs on this patient, and I called you, and I said, this is what I suspect. You came right over, right across the street to the office. Again, the team working together, me talking to you about the history, what the sports events were this guy played, and it was just marvelous how you came right over and helped our team out with that. I want to thank you.
Well, thank you. We both believe in collaboration, cooperation, and communication, and that has played a major role in our ability to treat people in a holistic fashion and look at the total picture, which I have found is extremely valuable in the preoperative period, in the recovery period. And in fact, there have been numerous studies to show that stress reduction and anxiety reduction, as well as even music playing before surgery, even during surgery, can reduce the level of pain and actually aid in healing. So I think this cooperation that we've developed is extremely valuable.
Yeah, it's a beautiful thing, and the patients love it. Let's talk about the other things that you work on, such as gallbladder, appendix, other things like that. And so that's 2. What other things might you operate on as a general surgeon?
Well, there's been a major shift, as most people are aware, towards laparoscopic surgery, which, if we talk about gallbladder surgery, has changed drastically the approach as well as the recovery period.
So how'd they used to do it?
Well, for the first 20 years of my training, we did that procedure through what we call an open incision, where we'd make an incision in the right upper abdomen, ranging in length from 4 inches to 12 inches.
Wow.
And when you do that, you have to cut through the rectus muscle, which can be extremely uncomfortable. And then we would remove the gallbladder in that fashion. That would take in the range of a half an hour to an hour and a half as far as the surgical time. And then probably 15, 20 years ago, the procedure changed to what we call laparoscopic approach, which involves small incisions and using a camera and what we call ports, which are little plastic devices. We can now remove the gallbladder in an ambulatory fashion. Patients go home approximately 1 hour after surgery, and by the next day, most people are functioning fairly normally, and I've had many, many patients who go back to work the next day.
Yeah, I went into the OR. You invited me into the OR one time with you, and I observed one of your gallbladder surgeries. I was amazed how you could just have these holes and then a big TV monitor, watching these instruments as you're working, looking at this TV monitor, and then actually taking the gallbladder out through one of those, I guess, ports.
Exactly.
Yeah, it was pretty cool.
Exactly.
Pretty cool.
And what we find, by the way, is you can actually see better with the laparoscopic approach because everything is magnified and, there's a light right where you need it. And in many ways, it's easier than the old-fashioned open operation.
Wow. Wow. And I'm sure with the old way, that recovery was a long time after cutting muscles and things, right?
Well, in many occasions, we kept patients in the hospital for a week after the surgery.
Wow.
So just to show you the difference. And once again, as far as recovery time, once we made that big incision in the right abdomen,
right.
People cannot lift anything heavy for about 6 weeks. Otherwise,
right.
there's a chance of a hernia occurring in the wound.
Right.
With the laparoscopic approach, it's basically full activity in a few days.
And you do an acute appendicitis the same way?
Exactly.
Laparoscopically through the cameras?
And appendectomies now are being done on an ambulatory basis.
Wow.
If the situation is appropriate.
Right.
If we have a patient with an early case of appendicitis, we can do it laparoscopically with 3 little incisions, and they go home the same day.
What else? What other conditions do you work on?
Well, I happen to be a general surgeon who treats many different areas of the body. For instance, many times I do thyroid surgery. Once again, we can do that in an ambulatory fashion, even as far as removing the entire thyroid gland. We've been doing that lately at the surgery center. I do breast surgery as well. And again, the whole spectrum of breast surgery can be done. Most breast surgical procedures can be done on an ambulatory surgery basis.
When you say breast surgery, you don't mean reconstruction. You mean like taking out cysts and things
Well,
like that?
the reconstruction part of it usually requires a hospital stay. But, ranging from a breast biopsy to a lumpectomy to even a mastectomy, can be done and is done on an ambulatory basis if the patient is right for that approach.
Right. Wow, I didn't realize you had such a wide range of things that you actually work with every day.
Definitely.
So if a patient, what kind of symptom, just tell the audience what kind of symptom a patient might experience in an acute appendicitis if they're at home.
Classically, acute appendicitis begins as pain in the upper abdomen, close to the breastbone, and transitions to the right lower abdomen, usually over a 6 to 24-hour period, and is usually associated with nausea and vomiting, and the pain tends to intensify as the hours go by. So if someone is experiencing abdominal pain that certainly lasts more than a very short time, they need to seek medical attention and evaluation.
Do they get fevers with that ever?
What I've found is there's no absolute with appendicitis. If you look in the textbook most of the time describes what we call anorexia, which is a loss of appetite with appendicitis.
Right.
It does not always occur. Fever can or cannot occur with appendicitis. Elevated white blood cell count classically occurs with appendicitis, but often does not.
Really?
So there are no absolutes when it comes to diagnosing appendicitis.
So you got to put all the pieces together and then come up with your opinion.
Well, now that we have sonograms and CAT scans, it immensely aids in the diagnosis because CAT scans are very accurate when it comes to diagnosing appendicitis.
And tell the audience what the appendix is and do we need it for anything?
Well, it's considered what's called a vestigial organ. We're not sure what it did, many eons ago, but at this point it serves no significant purpose. And it's a little round tubular protrusion off of what's called the cecum, which is the first part of the large intestine. And normally it's about 1.5 inches long by maybe 1/4 inch in diameter, but it can swell when it's inflamed and blocked to 6 inches long by 1 inch in diameter.
Gotcha. So it really has no function in our bodies today, and removal of it doesn't require any changes in nutrition or anything like that?
Not at all.
Okay. Gallbladder. Somebody has an acute gallbladder attack. Is it after they eat? Is it before they eat? Is there any general rule? What do they feel? Explain to the audience what a person might experience with that.
Well, gallbladder pain is usually very intense. There are three pains that we equate in intensity: kidney stones, labor pain, and gallbladder pain. And that, when someone describes a pain of that nature occurring in the upper abdomen, usually in the right side, but it can be in the central area, it's suspicious for a gallbladder problem. Now, most people who have a gallbladder problem, it's due to gallstones, although you can have a gallbladder inflammation without gallstones, but the majority of patients have gallstones with gallbladder pain. The cause of gallbladder stones is not totally clear, but it's a precipitation of the substance that's normally in the gallbladder itself. And we diagnose it often by sonogram, which will demonstrate the gallstones. The issue really is, just because someone has gallstones that are detected on a sonogram does not mean that anything needs to be done, because many patients have gallstones that are not causing symptoms, and we don't do anything in that situation.
That sounds very similar to our patient base, musculoskeletal conditions and disc herniations. We have many patients that have herniated discs, which are asymptomatic. Doesn't mean we have to treat them or do anything with them. But so do the stones, when they're there and are pathological and cause symptoms and problems, what do they do? Do they actually like cause inflammation on the inside of the gallbladder by mechanical pressure on the gallbladder? And is that what the pain is that they're feeling?
Most of the time, the pain is due to a stone blocking the exit of the gallbladder. In other words, the gallbladder's function is to store bile, and when you eat a fatty meal, the gallbladder contracts and discharges that bile through what's called a cystic duct, which is a tube that connects to another tube that connects to the intestinal tract. But if a stone blocks that tube, think of it as a pipe that gets blocked up, everything backs up behind it and causes the gallbladder to swell, become inflamed, become infected, and that's where the pain begins.
So bile is a substance produced by the body to help digest fats, correct?
Correct.
And when somebody has a fatty meal, the gallbladder is going to try to squeeze out some of that bile, and if there's a stone there and it obstructs it, it's like the pressure backs up into the gallbladder and nothing gets out, and that's the pain they feel from that, right?
Correct. It's not uncommon that, and this is one of the questions I ask patients, is what were you eating when the pain began? And it's remarkable that pizza is #1 on the list.
Really?
Yes. And pizza and cheese would be the #1 trigger for a gallbladder attack.
Interesting.
So that actually helps in diagnosing the condition. I'll ask patients, did you have pizza prior to the pain? And very often the answer is yes.
Huh. So after you remove a gallbladder, what does the patient have to change their diet at all? Are there any nutrients or supplements they need to take because they no longer have that bile being secreted out of there?
That's an excellent question, and obviously I get asked that all the time. The answer is that the gallbladder's function is to store the bile and discharge it, for a fatty meal requirement. But without the gallbladder there, bile is flowing all the time anyway. So you can live a perfectly normal life without it. The only issue I tell patients is for the first few days following the surgery, go easy on a fatty food intake. But after that, there are no issues with digestion.
Excellent, excellent. Well, Dave, I want to thank you very much for joining me as my guest today, and I hope to have you back again someday.
I'd be happy to.
Again, where can the public get in touch with you if they have any questions?
Well, my office number again, 631-423-7000, or email me directly at herniadoc1, HERNIADOC1 @gmail.com.
Thank you, Dave.
Thank you.
And as you can see, with a professional such as Dr. Benish and all the professionals that work with us hand in hand, you come into any of our facilities or any other facilities which have specialists working together, your chances are very good that you're going to get the best health care around. For those of you watching us on Madhouse TV, we'll be right back. For those of you watching us on Cablevision, we'll see you next time. And remember one thing, if you want real wealth, join us next time on The Bridge to Health.
Thanks for watching.
We'll see you next time on Madhouse TV.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Thanks for watching. Stay tuned for Bridge to Health right here on Madhousetv.com.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.
Hi again. Welcome back to the Bridge to Health. My name is Dr. Tom Dow. This week on our show, we have a return guest, Dr. Robert Kleinwax. Hey, Rob, how you doing?
Great. How you been?
Excellent, excellent. You specialize in many different fields. You were a chiropractor. We went to school together. Presently, you're doing a lot of different things. You're into nutrition. On our last show, we talked about your own personal experience and what you went through with an illness and how nutrition, changed things around, and some other things you did. I know you work with a lot of athletes, and today I'd like to speak about what kind of sports you've done in the past. We know you played a lot of tennis. Did you play professional tennis or?
Well,
semi.
Semi.
Right. And do you still give tennis lessons?
No.
Okay. I know you work with a lot of kids and you work with a lot of athletes. What are you doing working with them? How do you help them?
Well, what kids do is they come in with their parents usually. I work with a lot of younger kids from 12 to like 16. I have a bunch of college kids too, and professionals, but the bulk of it is the younger kids. And what we do is we find out where their linchpin is. Where is it what ties them to where they are? What doesn't allow them to grow? What is it about them, either nutritionally or mentally, that isn't allowing them to get to the next level?
What do you mean by grow? Mentally, physically, athletically?
Well, when I say grow, I mean in order to be better tomorrow than you are today, something has to change. Okay, so
better at what tomorrow?
Well, let's say it's hitting a tennis ball or swinging a baseball bat, or you're an MMA fighter, whatever you are. In order to get to the next level in your competition, if you want to call it, so that you can beat the people that you don't normally beat, or that you can be competitive with those people, there's a lot of linchpins. There's things that hold them back. It might be a mental stop. It could be a nutritional stop where they get tired prematurely, so they can't actually go all at it for the full time they're on a court, the full time they're in a ring, the full time that they're on a baseball field or a football field, lacrosse field, or whatever else it is. And very commonly, the physical part, or which is related to a lot of times the nutritional and the mental, okay? Everyone's looking at the physical part. They go work out more, they run more, when really, if they worked on the other two aspects, a lot of times that's where the breakthrough is, working with the mental part and working with the nutritional part.
Right. So those of you in the audience who watched our previous shows, we've talked about our model of healthcare, which is called the Wheel of Health, which has 5 spokes. The first spoke is proper nervous system function, making sure your brain communicates with your body. The second one is rest. The third one is nutrition. The fourth one is mental state, your ability to have a positive attitude. And the fifth one, what's the fifth one? Do we remember? Exercise.
Oh, exercise, yeah.
So as we talked about before, if all those spokes are not tight, the wheel starts to wobble. And when that wheel starts to wobble, it makes the other spokes loose. And before you know it, all your spokes, all those components I just talked about, are not functioning properly and your health deteriorates. So I think what you're focusing on is basically you got an athlete that comes into you, or a high school kid or a pro or whatever it is. What your job to do with them, it sounds like, is to tweak those spokes, whichever ones aren't as tight as they need to be, right?
Yes. And we have a big focus on 2 of the 3, 2 of the 5.
Nutrition and
the mental.
Mental.
Those are the 2 big ones we focus on.
Now you have a kid that comes in. He's a great athlete. Physically, he's in great shape. He's strong. But for some reason, he's just not hitting that baseball the way he should. Explain to me how you would work on that kid's mental state. What kind of things would you do with him?
Well, it depends on what he does wrong. Meaning, does he strike out a lot? Is it that he, in practice, can hit home runs all the time, but in a game, he stresses out?
We see that a lot.
Exactly. So then I got to deal with how he deals with stress. So we may do affirmations. We may do some visualizations.
Tell the audience what an affirmation is.
So an affirmation is basically a statement that's going to be repeated regularly, read regularly about the situation at hand. So let's say that someone gets stressed out when they come up to plate, up to the batter's box. So his affirmation may be, I'm always relaxed when I'm up to bat. I'm always relaxed when I'm up to bat.
And he'll keep saying that to himself in his head when he gets up.
My hands are relaxed when I'm ready to hit. My body's relaxed when I'm ready to hit. The affirmation may change, and they may have different parts of it. You may have multiple affirmations. But regardless, there's going to be something that they say mentally before they get into that batter's box to get them to relax just like they do in practice. Because in practice, they hit the ball great. And you have a lot of pros today using affirmations. Wow. And Alfonso Soriano, who is a pitcher and used to be for the Yankees, and I think he's with...
You've worked with them, right?
Well, he does affirmations. He takes his hat off, and his affirmations are in his hat.
Wow.
And he takes them off. If you notice when he pitches, in between every batter, he actually takes his hat off, looks at it, reads it, puts it back on.
Wow, I never knew that. That's pretty cool, man. So affirmations is one thing you might work with. What about any other things?
Well,
mentally you would work with?
Yeah, let's talk about visualization. So, you know, this person, let's just say that they are a baseball player, and I'm going to use that, and they get up to bat. Well, they may not, when they get up to bat, think the same way as when they're in practice. So we get them to visualize seeing the ball just like in practice. And again, doing the same steps that they do in practice in their head over and over and over.
Explain to the audience what you mean by seeing the ball just like in practice. What does that mean?
Well, we would have them close their eyes, and we'd actually have them visualize someone throwing the ball, them being up at bat with the bat, and them swinging and actually hitting it square on the fat part of the bat every time.
So they're seeing that in their mind before that pitch even comes.
And then they're hearing it. See, the thing about visualization, you want to use all your senses.
Right.
So, you know, we work with a lot of pitchers. So what we do with pitchers, for instance, we have them bring the glove up, and we ask them, okay, smell the leather. Well, I don't have the glove in my hand. Well, smell it. Okay, smell what the leather would be.
They're bringing it back from the memory.
Exactly. We have them see them throw and release the ball. We have them hear it hit the catcher's mitt. And we have them see what part of the plate it's going over. So we actually have them do that repeatedly over and over and over. If you have a tennis player and they want to play more net, we have them come up and actually hit backhand volleys cross court, backhand volleys down the line, forehand cross court, forehand down the line, and actually do mental training. Because the truth is that your physical body only responds to what you mentally put in, which is why you have so many great athletes, but they choke under pressure.
Right.
Because what they're putting in is, oh my God, oh my God, oh my God, which is a negative thought.
Right, right.
And they're putting these negative thoughts in their head as, oh gosh, what if I walk this guy, it's bases loaded. Well, odds are you're going to walk that guy.
Right, because you've already programmed your mind to expect it.
Exactly.
This kind of reminds me of, like, if you ever watch the skiers before they come out of the gates when they're downhill skiing, you'll see them there with their eyes closed, and they're going like this, and they're going like this. They're actually going through that course in their minds, right, before they even go down. And they're visualizing a perfect run before they even go down.
Gymnasts use it, divers use it. I mean, it's used in a lot of sports. The problem is it's not used enough in today's sports, in the younger groups. We're all about the physical, you know, let's hit more baseballs, let's ground more, do more grounders.
Let's get stronger physically.
Let's go in the gym.
Let's get bigger.
Exactly. And you can do a lot more mentally than a lot of times than you can physically.
That reminds me of a research study I read years and years ago. You probably read the same study, in which they took a group of college students, and they took 50 of them, and they brought them to a basketball court every day from the foul line, and they shot shots, and they practiced with that 50 people like 3 times a week for like 3 months. They took another group of 50 students, never even brought them out to the basketball court. They just had them, in their minds, imagine a throw go up with their eyes closed and a perfect switch through that hoop every time. And then when they came in and they tested the 2 groups against each other, the group that actually never practiced did better.
There's a lot of different studies on that. I mean, there's no question that visualization is going to be one of the staples in all of your sports, and a lot of them it already is, but eventually it's going to get into all the sports.
So do you think that when you hear of athletes like going into slumps, that a lot of times it's a mental thing going on, maybe in their personal life, or something that's causing them to slump?
Look at Tiger Woods. He was on top of his game.
Right.
And then what happened? He went through that nasty divorce.
And the scandal and all that.
And all that, and now, I mean, look at him. I mean, he's struggling to even make the cut a lot of the times, and it's not because all of a sudden he lost his golf swing. He lost his mojo. He lost the confidence.
He lost the eye of the tiger.
He lost the eye of the tiger,
right?
Literally.
Right,
yes.
Right. Wow, that's pretty interesting. So when you have a young student come in, let's say 13, 14, 15, 16 years old, do you actually do an analysis or any testing of them or any inventories or any questionnaires, standard, or is it just kind of like...
No, we have a whole questionnaire to ask them a lot of questions. Because what we want to do is find out what is their self-talk. You know, self-talk is what do you say to yourself constantly when you're on a tennis court or in a baseball field or whatever. What are you saying to yourself? Are you saying to yourself when you're on a tennis court, I don't know if I can beat this guy? Or are you saying to yourself, I got this? Are you saying, I don't know if I can stay 3 hours in the sun? Or are you saying, no problem, I can play for 4?
Right.
So what is your self-talk? What is it you say to yourself all day long in the sport you play in and in your life? Right. Because a lot of people have negative self-talk all the time throughout everything, whether they're playing a sport, whether they're with their girlfriend, their husband, their friends, everything is negative.
So now comes the interesting question. Get ready for this one. Hold on to your seat. So you and I have known each other 30 years, 35 years, maybe more. We went to chiropractic school together, and I think I shared this story with you. When I first got out of chiropractic school, I went to my parents and I said, look, I need money, I need a loan so I can open my practice. And God bless them. You know, I love them to death, even though they're not here with me anymore. But their response to me was, you should not try to open practice yourself. You should work for somebody for a while. You will fail if you do. And I basically, because of my inner strength and
your positive self-talk, hanging
out with you, I said to them, well, I'm going to show them different. And I was able to secure finances in another way. And within 3 years of the town I opened in, I was the busiest office in the whole town. I'm sure you have many, many students that you work with where you may have their parents telling them negative things or giving them negative messages which are affecting what you're getting into. Am I right?
Oh, there's no question. I mean, a lot of times we actually work with the parents. You know, I wrote a book called The Sports Triad, and in it, it actually talks about the 3 parts of being an athlete, the physical, the mental, and the nutritional. And a lot of times the mental part, I have to work more with the parent because the parent is feeding them the wrong information.
Right.
You know, they're constantly saying, oh, gosh, you know, if you can't work out 3 days a week, then you're a loser. Or if you can't do this, then and they're feeding them negative stuff instead of the positive stuff this kid needs. And there's no question, kids are influenced heavily by parents and coaches. And what they say to this kid is so important because a lot of times they're a reflection of the coach, which is why you see so often in professional sports, you have a losing team. They change coaches, and the next year they're a winning team. Well, it's the same guys. How did that happen?
Right, right.
You know, it's just here.
How often do we see the kids playing Little League or high school ball, and their coaches are screaming at them, they're yelling at them, they're giving them negative words, they're embarrassing them. That's got to be devastating for that kid's psyche next time he gets at bat, right?
Oh, there's no question. There's no question. Everything that you say to a child, and I say child, you know, a teenager included, is going to imprint their head. And so the things that are imprinting, you want to be positive.
Right.
And so a lot of times when they're doing affirmations or they're working on positive self-talk or they're doing anything, visualizations, it's so important that the parent gets taught all these skills because they have to make sure that they're not slowing that process down.
Right.
That they're not getting in the way of this poor student who's trying to work hard on it and the parent keeps kind of breaking it up because the way that their orientation is.
Right.
Their orientation is negative.
Right.
So, you know, a lot of times we have to work with both the parent and the actual athlete.
That's very, very awesome. I'll never forget the when I applied for, right, was a senior in high school or late junior or something. I applied to go to school at University of Buffalo, you know, as a bio like pre-med major, and my guidance counselor called me into his office and he said, "You shouldn't do that. You will never ever get in with your grades. You only have like a 88, 89 average. Don't even bother. You should look into BOCES and do some type of blue collar work because I don't think you're college material." And thank God I did get into it. I actually was on the waiting list. Then I got into it. I graduated a 4-year degree in bio, and I'm sure, as you remember, I hope you don't forget, we're in the same class. I graduated valedictorian of the chiropractic school. I want to make sure you didn't forget that one.
And who was second? I forgot.
I think it was you, wasn't it?
Yes.
And then I went to a 20-year high school reunion, and I saw that guidance counselor. And I went up to him and I said, "Hi, how you doing? My name's Dr. Dad. Do you remember me?" He goes, "No." I said, "Oh, I'm the guy that you told 20 years ago it wasn't college material. I just wanted to introduce myself and tell you I made it. And are you still working?" "Oh, yeah, I'm still working." I said, "Please don't do that ever to any other student because they might believe you. I didn't." Yeah. So even our teachers, even our guidance counselors, we have to be very, very careful on what they're telling our children as far as success models and, you know, putting these negative, not even knowing they're doing it, not intentionally trying to hurt them, but maybe that's the way they were brought up, right?
Yep. There's no question. I mean, the brain is an incredible, incredible machine, and you know we can't live without it. I mean, it's one of the few organs you can't live without,
right? And
it's programmable just like a computer is, and we have to look at it as a computer and what kind of program do we want to run in it?
Right.
Do we want to run a success program or a failure program?
Right. Okay, so now you got to deal with the moms and dads sometimes to try to reprogram them so that they don't deprogram their children to success. And now you also have to work a lot with their nutrition sometimes. And you've got to explain to the parents why they can't keep eating all the junk food they keep buying, the snacks, the cakes, the salty, the contaminated products, the Burger Kings, sorry, Burger King, McDonald's. But the things which are not going to help that child succeed in whatever he's trying to do with you. Am I right?
Yeah, there's no question. I mean, the diet part, believe it or not, isn't as difficult for a parent as the mental part.
Wow.
You know, the diet part, you know, a lot of parents want to eat healthier themselves.
Cool.
But changing their brain when they're 30, 40, 50 years old is a lot of undoing.
Right.
But eating healthier, most people want to do it because, one, they want to stay healthier themselves, they want to stay thin, and they want to stay in shape. So that's not as hard. Though for the kids, on the other hand, believe it or not, that's harder for them.
It's harder for the kids and the parents.
It's harder for the kids and the parents a lot of times because when they go to school, the parent's not around. And all the junk is in most of these school districts. And so bottom line is, you know, it's tempting. There's parties, there's, you know, just stuff that they shouldn't be eating. And in sports, it's not just what you eat, it's when you eat it.
Right, right, right.
You know, so you shouldn't be eating right before a big meal, right before you go and do an athletic event.
Right.
But meanwhile, a lot of times they'll have lunch at 1 or 1:30, they'll have a late lunch, and then they're out on a soccer field at 2 or 2:30 for a game.
No good.
And meanwhile, all the food's in their stomach trying to digest.
All the blood's there.
All the blood's there, and instead of the blood being in the extremities and in their muscles, where it belongs, and, you know, which would give them energy, now it's trying to digest all its food.
You're right. You're so right about that peer pressure with all the junk that the other kids have and they're eating and the parties and things like that. But it blew my mind. My little guy's going into middle school this year. He starts 6th grade. And I cannot believe what they have in the vending machines in these schools.
Yep.
I mean, terrible, horrific things that have to be detrimental to the children. Why aren't the schools more involved in getting healthier food in there?
Well, I think they are. I think that's starting to happen now. More and more schools are starting to look at it because behavior issues, if you look at them, there's more after lunch than there were before lunch in a lot of these schools because of how poor some of these lunches were.
Poor behavior is higher after lunch?
A lot of times after lunch, and poor test taking there's worse grades a lot of times after lunch than before lunch.
Huh. Interesting.
So there's been a lot of studies on it. But the bottom line is a lot of the school districts now are getting pressure from not just the parents, okay, which is a great place, but from a lot of these health organizations that are actually now starting to infiltrate the school. So it's getting there. I mean, I would say what happened 20 years ago and 15 years ago and now, it's definitely better.
So you have a 14 to 16-year-old soccer player, football player, baseball player, student athlete come to you. Do you ever tell them just eat food and don't take nutrients, or do you think certain supplements are essential, even if they eat well, as a student athlete?
I mean, that's a great question because, for years in my practice, I sold vitamins, and I stopped because I couldn't find vitamins that were really, really absorbable. A lot of times, and I'm sure you saw this, we'd x-ray a patient, and the vitamins would be in their intestines.
Sure.
They'd never break down in the stomach.
Not even broken down, passed right through, making a real healthy cesspool.
Exactly. So what I started to do is research it, and I quickly found out that there's a huge difference in vitamins and the way they're made and the content of the vitamin itself. And I started my own vitamin line for my own kids, actually. It started for my kids because I wanted to give my kids vitamins that I knew were vitamins they could break down. And by the way, if you're not sure, go home, take your vitamins, take a little bit of vinegar in a glass like this, pour a little of the vinegar in it, throw your vitamins in it. Wait 45 minutes to 50 minutes. If that vinegar hasn't broken down those vitamins, your stomach can't either because the vinegar is almost the same acidity as your stomach. So we call it the vinegar test.
Wow.
So I always ask clients, let's take the vinegar test with your vitamins. They bring them in and we put them in, and at the end of the consult, we see if they broke down. If they did, then we leave them. If they didn't, then they switch over to my stuff because I know all my stuff breaks down very quickly. And that's very important because first it has to break down and then second has to be absorbed.
Right.
So we got the first part down, which is it breaks down. The second part in a lot of the vitamins, does it get absorbed? Now a lot of the vitamins, the way that the vitamin is actually made, it's in the wrong form. Your body can't absorb it. Mm-hmm. So you have just really expensive urine.
Right.
So the trick is to have vitamins that break down and vitamins that you can absorb. Right. And part of the absorption is the percentages and the amounts in it. A lot of times you see this, and you see it a lot in protein shakes. They advertise, we got so many grams of protein. Well, if your body can only break down 22 to 24 grams at a time, then what does it matter if there's 30 or 40 in there?
Yeah, you're just putting them right out of your body.
So it's the same,
utilizing them.
Exactly. It's the same with vitamins. So it's essential to know how many milligrams of something your body can actually handle a day.
Well, we live in this culture of more is better.
Exactly.
Where if it's more and you're not absorbing it, it's not better for you. It's going right through your body, right?
And a lot of the cheaper vitamin companies, that's how they push.
Right.
They get a lot of something in there, so you think you got a good deal.
Right. So answer my question now, will you please?
Go ahead.
Does a student athlete that you see need to take supplements in addition to eating well?
Well, the answer is simple. If they take supplements that are broken down easily and supplements you can absorb, the answer is absolutely yes. But
such as what type of supplements?
Well, let me just go back a second. Let's just go back a second. There's a whole lawsuit against Walmart. I think it's Walgreens, Target, and a couple of the other, because they took the actual vitamins that were in herbs that they were selling, and they did an analysis on them to find out that what was in there wasn't really in there.
Right.
So that's why I'm hedging on this. Is just because you're taking this vitamin doesn't mean it's actually being absorbed. So yes, I think you should take vitamins. I think your body, even as healthy as you eat, can't get everything that you should eat.
So you take your students, you recommend yours because they're pure, they work well.
Or I test others and make sure that if they're testing,
the ones they're taking,
they're taking, they're good, then fine.
So the ones, let's say they're taking nothing and they're starting with you and they're working on the mental, they're working on the nutrition. What basic supplement would you recommend would you recommend that everyone take a multi-mineral vitamin? Do you recommend an athlete take a vitamin C? students at this age.
So depending on what they're doing, you know, a bodybuilder is different than a tennis player, who's slightly different than a lacrosse player. So depending on, again, what sport it is, you definitely want minerals.
Right.
You sweat them out, everything you do. So you want minerals. And a multi with minerals is great, or a mineral and then take a multi.
Okay.
But again, you want to make sure they break down. Vitamin C, without a question, for everybody. It helps with collagen repair, and most sports do tear ligaments and tendons in the sport with little micro amounts, and you want to repair them constantly. Now, depending on if you're a weight person and you're doing a lot of physical, and some of these MMA fighters, some of the wrestlers do it, then you may add a protein shake of some sort. You know, I'm big into the vegetarian ones, even though I sell whey. I think the whey is a little harder to break down. The vegetarian's a lot easier to break down. You absorb it better. As far as other vitamins go, again, depending on the athlete and depending on what they're doing, if I got somebody who's a bodybuilder, I'm going to give them a pre-drink and a post-drink.
Right.
But almost everybody, I like them to take greens. I have greens that come in these little envelopes that you pour the envelope in either juice, water, whatever, you shake it and you drink it.
Right.
The greens help alkalize your body, and basically your body wants to be alkaline. You can absorb better when you're alkaline, you have more energy when you're alkaline, and you think better when you're alkaline. One of the reasons that you'll find that when people drink a lot of alcohol is their thinking process goes a little wacky, is alcohol actually makes your body acidic, or makes it more acidic.
Right.
So it does alter the way you think on top of what alcohol itself does.
Right.
So it has a double whammy. So greens are one of the most important things to me for everybody, athlete and non-athlete, to keep the bloodstream alkaline, which is what your blood is supposed to be.
Interesting. Very, very nice. We're just about running out of time right now. Can you just let the audience know how to contact you, your website, your phone number?
Sure. I mean, my number's easy. It's 516-200-5400. Again, it's 200-5400. And my website is www.eatandthinktowin. And the number 2, win. So it's eat and think to win.
Excellent, excellent. Thank you very much for joining me again, and I hope to have you back soon. And for those of you in the audience, Dr. Kleinwax regularly works with us on the phone. We'll have his nutritional line in our office shortly. If anybody's interested in checking out his products, you can also call him or go on his website. And just understand that, as I've said many times in the past, our healthcare professionals always work as a team for you, the patient, to give you the best strength of every one of your spokes in your wheel of health. Once again, thank you for watching, and remember one thing: if you want real wealth, join us next time on The Bridge to Health. We'll see you next time on Madhousetv.
Finally, the time has come. You no longer have to choose between conventional medicine and alternative medicine. Today, unlike years past, your team of doctors from all disciplines are working together side by side for the benefit of you, the patient, to help you regain your health and cross the bridge.